When Henry Nestle first created his baby formula back in 1867, the whole idea was a supplement to help mothers who couldn't breastfeed their children, certainly not to try and replace breast milk altogether. And the reason for that is studies have shown that natural breast milk is healthier than any formula. Natural breast milk is widely recommended by the World Health Organization, American Medical Association, UNICEF, and countless others. So for a while, baby formula was sold simply as an alternative for those who needed it. But in the 1970s, roughly 100 years after the company first began, sales seemed to be slowing down, and Nestle started to get greedy. They wondered, what if we could sell this baby formula to all mothers, not just those who actually need it? You see, despite all the other products Nestle had launched, baby formula was still one of Nestle's biggest moneymakers, and that's because it has very high profit margins. So imagine how much more money they could make if they could expand their market to all mothers. So Nestle began a campaign to undermine breast milk and aggressively advertised their baby formula as being superior, manipulating mothers into believing Nestle's formula was a necessity for the health of their babies and that it would be better for their child than breastfeeding, when in reality, the evidence was the opposite. Nestle's formula was vastly inferior to natural milk, as it lacked many of the nutrients that helped babies fight off disease and keep them healthy. By encouraging mothers to switch when they didn't need to, it was putting their babies at a higher risk of infection and malnutrition. In order to make sure mothers believed this information though, Nestle began paying off doctors and hospitals to peddle their formula by asking them to tell mothers it was better than breastfeeding. Nestle then ramped this up further in Africa and Asia, where they would hire saleswomen to dress up like nurses and convince mothers to give up breastfeeding and use their formula instead. These saleswomen were paid on commission, meaning the more formula they sold, the more money they made, thus encouraging them to sell the formula very aggressively, which they did. These saleswomen, posing as genuine nurses, would walk the halls of maternity wards, or even visit mothers at their homes unannounced and sell them on Nestle's baby formula. And it gets much worse. Nestle got these fake nurses to hand out free samples of their formula to mothers. Except they gave them just enough samples that by the time the samples ran out, the mothers would have stopped producing milk naturally and thus had no choice but to pay for Nestle's expensive product to keep their child alive. This proved to be very successful and profitable for Nestle, and so they expanded this plan to many other locations, but especially developing nations, where many of the women weren't educated enough to know the information they were being fed wasn't true. After all, if a woman who appears to be a qualified nurse is telling you that your baby needs this product, you're just gonna believe them. Of course, the consequences were fatal. It's estimated millions of babies died or were made severely deficient in essential nutrients because of this. The worst impact was in third world countries where there was no access to clean water. The big problem was that the baby formula had to be mixed with water, and yet Nestle was convincing people they needed to use this baby formula in places where clean water was in very short supply. So the formula was getting mixed with water that was polluted and contaminated, thus making the babies ill. To make matters even worse, because many of these women couldn't afford to keep buying the baby formula that their babies now depended on, they instead diluted it with even more water, which meant that the babies didn't get enough of the nutrients they needed from the formula, leading to malnutrition. It didn't help that the instructions on the packaging were in English, which most of the mothers in these countries couldn't read, so they didn't even realize that by diluting it so much, they were starving their children. This also meant many of them didn't know they needed to boil the water first to prevent bacteria making their baby sick. For a while, Nestle did nothing about any of this, and seemed to be getting away with it all. But then in 1974, a publication entitled The Baby Killer specifically called out the serious consequences of aggressively pushing baby formula in these countries. Nestle was listed for its involvement in creating a need that didn't exist before, then convincing consumers the product was necessary, and then getting them hooked on it, all whilst completely ignoring the tragic consequences. When this was translated into German by Swiss campaigners, it was given the very blunt title, Nestle Kills Babies.